unfortunately, that's a form of disease that is irreversible and very expensive, because for that 1%, you may need, with certain forms of therapy, you may need 50 million shillings a year, 1 million shillings a week. And 1% still means that if we are talking about 40 million Ugandans, we are talking about 400 people or so. But we've got very few kidney experts. We are talking about less than 10 people for a country of 40 million people. So that means one for every 4 million people. "40 dialysis machines in total, private and public. And that means one machine for every 1 million people. That's very small. We are coming from a background where we've had to deal with a lot of communicable diseases. And these are reflected in the structure of our public health programs, robust programs for HIV, TB, and malaria. And only after controlling those things have we been able to focus on kidney disease. And there's a steady growth in the capacity. And so now we are able to talk about 10 kidney specialists, and 10 years ago it was 1. So there is some growth, and the training doesn't happen locally. In Uganda, the form of transplantation we have is living donor. It means that someone makes a decision to give you a kidney. And it's supposed to be free, no coercion, and no promise of rewards. And so typically after going through a period of assessment to decide whether there is a good match, we send them out of the country to have the transplantation done. Only the more advanced society have deceased donor programs, which means that if I wanted to give my kidneys and I got knocked down in the street, or I got shot, God forbid, and my kidneys were accessible, they'd be preserved, and the waiting team would give it to a patient who would be rung at that moment. So it talks about a lot of commitment of resources and a lot of standby teams, a high level of organization. We think that that's still a way off.
Of course, it's important for us, our technical team, to be at this conference, to be able to see what other countries are doing, how other countries are progressing in this area, and of course that will help us in building our own legislation here, and of course also the capacities and the contracts. We are in the process of transforming our Mulago National Referral Hospital into a specialist hospital to start providing such services like the kidney transplant, the cornea transplant, and other transplants.